Dr. Job for joining with us today. Thank you, sir. That was a wonderful session. So for our next session, we have Dr. Dasari Harish. Thank you, sir. We have with us Dr. Dasari Harish. Sir, welcome. And yes, and very interesting topic, scope for various super specialties in forensic medicine and toxicology way forward. And I think you're one of the best person in country to talk about it. Sir is professor and head of Department of Forensic Medicine and Toxicology. Again, a very easily approachable person for the PGs who are here. Anytime you call, you ask doubts, sir is always ready and helpful to others. And to chair the session, we have Dr. Vijay Kumar Nair and Dr. Srimat Kumar Dash. Dr. Vijay Kumar Nair, I invite you to now introduce our speaker.
Am I audible?
Yes, sir, you're loud and clear.
Yeah. Good morning, everybody. Good morning, everybody. I welcome Dr. Dasari Harish to proceed with this presentation. Thank you. Is it audible?
Yes, sir. You're audible. Yes, sir.
I am supposed to introduce. Is it not?
Yes, sir. Yes.
Yeah, Dr. Dasari Harish, I know, is a very good friend of mine. So academically, if you want to tell, is a PhD guide to the Punjab University. Is ex-editor, Journal of the Indo-Pacific Association of Forensic Odontologists, Journal of Indian Academy of Forensic Medicine, is former president, Punjab Academy of Forensic Medicine and Toxicology, is head One-Stop Crisis Center for examination of survivors of sexual and domestic violence, is chairperson, UT Standing Committee for examination of pregnant rape victims, distinguished fellow of ICFMT, fellow PAFMT, and is commendation certificate by the administrator, Chandigarh administration, COVID warrior. So I welcome Dr. Dasari Harish for this presentation. Thank you.
Thank you, sir. Dasari, sir, over to you. Happy to have you, sir.
Yeah, am I audible?
Yes, sir, you're audible.
Okay. I'm going to share the screen, please.
Yes, sir.
Dr. Dasari Harish.
Is this visible, please?
Sir, no.
Yes, sir. You are visible and audible.
Okay.
So your screen, but
Screen
it's
is not visible.
Yes, sir. Screen is not visible.
Screen is not visible.
No, sir.
Okay, wait.
I think you're not shared your screen, sir.
Now, is it visible?
You're starting to share.
Hello?
Yeah.
It hasn't come
my
up
screen
yet.
visible now?
Yes.
Yes, yes. It's visible.
Okay.
So can
I'm
you
going
make
to
it
put
full
on
screen,
the
sir?
slide mode.
Yeah. Yeah. Thank
Okay.
you, sir.
See, I think before I speak, I start my topic. I think this is the first conference of Dr. James and Dr. Arti. So they are a bit overwhelmed with the speakers, and we have overshot by almost 1 hour. I think that this is not correct. I'm sorry, but I think this is not correct. We are in a virtual conference, and in virtual conference, we are perforce in the office, and we have to reschedule for presentations, and that makes it a very big problematic affair. Anyway, kudos to both of you for this national conference, and thank you for inviting me to share my views. I have searched the literature and I have not found anything. So whatever I'm going to speak is purely mine, with some inputs from here and there. Now, forensic medicine is the application of knowledge of medicine and allied subjects we apply this to law for the administration of justice. And medical jurisprudence is the application of various aspects of law to day-to-day practice of medicine. Hence, by definition itself, forensic medicine is an all-encompassing field. It utilizes the knowledge of medicine and allied subjects in whatever aspect of life that we can think of. As I said, we cannot think of a single act that we do which does not involve the speciality of forensic medicine. The air we breathe may be toxic. It may have deleterious effects on the person, which would involve compensation. And when this happens, we require a forensic expert to tell us about the quantum of compensation. The water we may drink may be polluted, food we eat, vehicular accidents, day-to-day accidents, assaults, medical negligence cases. Think of anything and you require a forensic expert. That is the importance of this field. However, what have we done for our field? And what are we doing for our field? Nothing, except for some instances here and there. We are discussing way forward, and I hence may be forgiven for expressing my views in this August gathering. We have restricted ourselves only to conducting post-mortem examination, and the two, not all departments of forensic medicine do. In some institutes that I have inspected on behalf of the then MCI and the present NMC, the Department of Forensic Medicine does not perform post-mortem examinations, nor does it do medical legal work, even though they have a full-fledged faculty, staff, and the mortuary is under their control. They just open and close the doors, and non-MD GDMOs, general duty medical officers, perform these examinations and do the medical legal work in the department's mortuary. In most PHCs and SHCs, PHC is a primary health center and SHC, you know, is a secondary health center. The post-mortem examinations are performed by these doctors only, who do it in a cursory, superficial way so as to just complete the protocol. And this leads to a number of mistakes and makes the subject of forensic medicine seem bad in the eyes of the law. In some places, I have also witnessed what are known as telephonic autopsies, where the doctor doesn't go, but does the autopsy in his room by just asking what has happened to the body and getting the answers from the mortuary attendants. Most of us only talk about uplifting the subject. You pick up any forensic medicine social platform, you have everyday people talking about it. And they think that their duty is over once they have said they put up their comments and received a sabash or sabashi from their colleagues. Nothing else happens. Now, let's talk about our mortuaries, which I think is the one basic requirement of any department of forensic medicine. In September 16, 2015, the Delhi High Court was shown photographs of the instruments and the mortuary of Sabji Mandi police station, Sabji Mandi mortuary. And this was what the Honorable Delhi High Court said. What people have to endure is disgusting, and apathy and the situation makes one want to resign and run away. Is there any SOP or screening process? You think mortuary belongs to dead people, so everything there should be dead. The people working there are also dying. These tools belong in a museum. The dead cannot be butchered and hammered like this. This is the exact wordings of the Honorable High Court. According to the Tribune, the condition of mortuaries in Punjab are very poor. According to the Times of India, 79 workers in the mortuaries at Bhagwati Hospital, Borivali, JJ Baikula, Cooper Juhu, and Rajwadi Ghatkopur daily struggle to work in conditions where at every step there is a risk of contracting infections like HIV, hepatitis, and tuberculosis. The workers there revealed how 4 centers have more than 200 unidentified dead bodies in various stages of decomposition, and Many corpses lie unwrapped on floors as storage units have run out of space. And this is what is the condition of mortuaries in most parts of our country. What can we say about uplifting the subject? I think at present, the only way forward is to first and foremost do one's best for improving the appalling condition of the mortuaries of the country. Now, there's a new topic on the block, if I may be allowed to say so, which is known as virtual autopsy or Autopsy, as coined by Prof. Richard. Everyone is talking about, everyone wants to have a virtual autopsy center, but I do not think that everyone knows what actually is virtual autopsy. Some well-funded departments have even established a part of the requisite machinery like digital X-rays, CT scans, etc. I do not think any forensic medicine department in India has set up a dedicated MRI plant. According to me, virtual autopsy or autopsy is not justified at present. Reason is mostly monetary. The setup costs at least 5 to 6 crores for just a multi-slice CT. In a country where even basic amenities for mortuary are lacking, where common people have to endure a lot of effort, harassment for investigations, etc., talking about this kind of expenditure for postmortem examination is not correct. Some nodal institutes, maybe like AIMS Delhi, PGH Chandigarh, may be earmarked, and government funding can be done to develop such centers of excellence. But for the rest of the country, this is a no-no. Now let's talk about the procedure. We need CT films, MRI films. Who does them? A radiologist. Who will read and interpret them? We cannot. Again, we need a radiologist. Now, a radiologist cannot write a proper PMR even though he is qualified to do so, as he is an MBBS. Otherwise, if you talk about virtual autopsy, this would have gone to the Department of Radiology and not to Department of Forensic Medicine. Hence, a board has to be formed and a radiologist becomes the more important person in such cases. Even though we do include posting of radio diagnosis department for 2 to 3 weeks in MD curriculum, and we do teach the PG students interpretation for X-rays, for fractures, appearance and fusion of various ossification centers, appearance and maturation of teeth. We cannot teach them interpreting CTs and MRIs, which only a radiologist can do. This is one more reason why virtual autopsy is not a viable proposal in our country. Now let's talk about super specialization, which I have been asked to do so. We can have DM in forensic toxicology. That is the first thing that came into my mind. We do teach, but we do not practice. So we only teach the theory of toxicology to the UGs and PGs. The practical aspect of this is done by the Department of Medicine, Pediatrics, or Emergency Medicine. However, since we teach the subject completely, the sources of poisons, their detection, clinical manifestations, treatment, postmortem findings, etc., if given a chance, we can treat such cases. Initially, we might require the support and supervision of the medicine department and also of the anesthesia department, but later on we can do so on our own. Hence, we can have a super specialty, forensic toxicology. The candidates during their DM can be posted in various centers, ICUs, medicine department, pediatrics department, neonatology, anesthesia, and community medicine, as well as the various trauma centers. Since poisoning involves corrosives also, posting in burns and allied specialties, particularly plastic surgery, may also be included in the curriculum. And for the analysis part, these students can be sent to the state and forensic science labs for analysis part to become a complete specialist. In our department, we do send our PG students to 2 weeks training in the Central Forensic Science Lab, which is attached with the UT administration, and we do that. But in cases of DM, you can send them for a longer duration so that everything about the analysis part can be learned by them. Since we are completely conversant with the theory, if we brush up and further specialize, we can be of good use to the society as a forensic toxicologist. Since almost all hospitals deal with such cases, whether government or private, jobs can be created and super specialists can put their skill to use. They can also have their own poison information and treating centers. The domain would include emergency toxicology cases and saving intervention, treatment of adult, pediatric, neonatal cases of poisoning, etc., both in hospital and community settings. Besides doing medical legal work related to the case and OPD basis treatment of follow-up of cases. So all this can be done by a specialized or a super specialized person. This person will also be the master trainer in the hospital settings. He can be appointed at district level health centers and at tertiary care centers to be the master trainer in such cases. We all know that the Department of Forensic Medicine Toxicology, AIIMS Raipur, has started a DM course in medical and forensic toxicology. The eligible candidates for this are MD in medicine, MD in forensic medicine, MD in pediatrics, pharmacology, or emergency medicine. We also know that certain institutes are running courses of PhD in forensic toxicology. I know of certain AIIMS, and I also know that PGI Chandigarh also runs such course. But I am not sure whether only an MD in forensic medicine is eligible for this, or even non-MD students can pursue it. If non-MD or non-MBBS medical students pursue this course, they cannot treat patients. And hence this course, this super specialization, will only become academic without serving much purpose to the society. The another course that we can think of is DM in medical jurisprudence, including clinical forensic medicine. That person would be a master in medical negligence cases while also being an expert in supervising all medical legal examinations by the institute. He can be appointed by corporate hospitals, law firms dealing with such cases, as he would be the person when it comes to litigation on account of medical negligence and related matters. He can be a master trainer in prevention of these cases, protecting hospital and doctors against litigation. And he can serve as a district expert dealing with such cases. Thorough knowledge of law in relation to these cases should be included in the curriculum, along with posting in clinical departments, community medicine, attending course in medical negligence cases, etc. He can be a trainer for the newly appointed public prosecutors, judges, police officials, forensic personnel, etc. The eligible candidates can be those who are MD in forensic medicine or in hospital administration. University of Manchester is offering a three-year full-time or a 6-year part-time distance learning course in PhD in bioethics and medical jurisprudence. It is based on the presumption that they have realized that the national, regional, and local governments and organizations require highly trained people in healthcare, ethics, and law. The program includes innovative schedule for a publication-based PhD. The candidates would then have opportunity to closely work with the Centers for Social Ethics and Policy in UK. Universities world over are offering courses in bioethics. The Kunming Medical University, China offers PhD in medical jurisprudence. If you just do a Google search, you will see that it yields number of results. The Law Institute India offers PG degree diploma in medical. PG certificate course in forensic and medical jurisprudence is offered by Dr. D.Y. Patil Law College, which is affiliated to Pune University. This degree is recognized minimum eligibility requirement of these cases. Now, DM in forensic pathology. This we cannot call as a true specialty of forensic medicine because the basic degree required would be MD in forensic pathology. As if we go by the definitions, forensic pathology is the application of knowledge of pathology and allied subjects to law for administration of justice. So I think the basic degree required would be MD in forensic pathology here than MD in forensic medicine. However, it can be thought of, and if our learned colleagues put their mind together, we can bring out a course for super specialization in DM in forensic pathology. We all know that histopathology is a part of the curriculum in MD forensic medicine, and in the practical examinations, candidates is tested on his ability to stain and examine unstained slides, as also examine and interpret the findings of stained slides. Hence, we can think of a super specialty in this subject also. The eligible candidates could be MD in forensic medicine and MD in pathology. Society of Apothecaries London offers DMJ in pathology. Other fields for super specialization could be forensic dentistry, forensic radiology, forensic psychiatry. However, again, the basic degree required, PG degree required, would be the main subject and not forensic medicine. But as I have said earlier, we do teach UGs and PGs regarding X-rays for ossification centers, fractures, any such anomalies. Hence, radiology as a subject for super specialization can be worked upon along with the Department of Radiodiagnosis. Many dental institutes have started PG in forensic dentistry, but for them, BDS is the main degree and not MD in forensic medicine. The government of Maharashtra has even allowed forensic dentists to be appointed in the Department of Forensic Medicine on contract basis. So I would like to conclude by saying that we have presently a super specialty course in forensic medicine. It is in a budding stage, and this should give us impetus to explore and come out with the areas in which there is scope for enhancing our knowledge as a super experts. But even now, the first thing is that we should bring out the necessary mandatory requirement, that is improving our mortuaries so that they become less hazardous places to work and we serve better purpose to the society. These are my references, and thank you.
Thank you, sir. It was a very good talk.
Yeah.
And you have put more onus on super specialty with respect to DM in forensic pathology, odontology, radiology, etc. So thank you, sir. Any comments from co-chairperson?
Professor Harish, good afternoon, sir. This is Dr. Das.
Good afternoon, sir.
Good afternoon, good afternoon, good afternoon.
It was a nice presentation, sir. You have told the very bitter truth, rather, the fact in the ground, and it's the reality, where we stand and what we are imagining of.
Yes.
DM forensic toxicology has started as a super specialty in AVMC Raipur. It's in a very nascent stage and in the first year of its life. Still a long way to go. Still it is not acceptable by many of the other departments where the DM student has to work. And other areas like DM and medical jurisprudence and forensic pathology, obviously, definitely it's a part of our curriculum during PG. Also forensic pathology we can think of, and definitely we have to give a lot of thought to this area, especially forensic pathology, as you have suggested, so that it will be very much relevant to our subject and we can progress. Your presentation was very clear, loud, and to the point. Thank you for the presentation, sir. Thank you.
Can I ask a question? Harish, hi.
Yes, sir.
As you rightly said, basically this subspecializations come from the parent specialization. Like forensic neuropathology is a very strong subject, but you have to primarily be a pathologist. Similarly, I know personally very well the forensic radiologist who's in Victoria Institute of Forensic Medicine, Melbourne. He's a very interesting character that he's got his background. He first qualified as a veterinary surgeon, then he did his MBBS, then he did his radiology, then he worked in forensic radiology and built it up, and he's now conducting courses and everything, and he's available to the department twice a week, and he's on call, he virtually accesses the stuff. I've even attended workshops with him. So this is the difficulty. I don't think we can overcome this.
No, sir, we cannot overcome this, sir.
But having been an association, because we send our trainees to VIFM, Melbourne, and they do the Australian exam because UK has now really gone fat. So, and UK's training is awful. I mean, there is virtually hardly all the forensic pathologists are run away to Canada. Yeah, those who did not have other subspecializations, like Helen Whitwell, she's also a neuropathologist. So she's working with neuropathology, clinical and others. So the forensic pathologists of VIFM, some of them have subspecialized in things like neuropathology. Some have actually specialized in cardiopathology. But then that has arisen from the fact that if you're giving the RCPA, Royal College of Pathologists of Australia exam, you are primarily, in fact, if we forensic pathologists, we forensic medicine people want to qualify there, they want you to be very sound in pathology, including cytology. So you are competent enough to practice as a histopathologist, cytopathologist anyway, and if you've done it with a slant towards forensic pathology, you can also do forensic pathology work. So I know at least 2 persons there who are actually functional neuropathologists. I know one, I think, who's a cardiopathologist, but that derives from the basic way that they qualified. In the US, you have to first do a clinical anatomical pathology and then do 1.5 years of forensic pathology afterwards.
So forensic pathology in the US is a super specialization.
Yes, it's a
and you have been a pathologist first.
Yeah, which is about 3-4 years. And we have lots of people from MAMC who are there now, who've gone that route. So the thing is, if we had a sound recognized base in other disciplines like pathology, etc., then we could venture out into the subdivisions, because neuropathology is really interesting and quite a lot of neuropathology work can come into trauma pathology and therefore forensic. Though of course the esoteric stuff of tumors and other things and all do come in. But nowadays that's taken out of your hand very easily because you have these immunohistochemistry and all to tell you exactly what is not, you know. So it's not just your diagnostic pattern recognition sense, it's also the color matching, signal matching sense to help you diagnose. So it has become a bit easier to that extent. But I as you rightly said, I find this a big dilemma that the subspecializations that are coming up like clinical, like forensic toxicology, it's going to be tough because as somebody actually commented in the chat, why will somebody who's going to share their bread and butter with you? I appreciate the person's very lucid comment.
It's a fact. The problem at present in our country is that forensic medicine itself is not accepted by the clinical people. We are still second-rate citizens. If you allow me, in our own college, in number of universities, I have seen that when the fact comes to sharing the funds allotted, then nobody thinks about forensic medicine. If something is left, they will still give to some other department, and only when we literally beg them that we get some funds. That is the present situation of forensic medicine in a number of colleges in our country.
Okay, there is one route by which we could go. See, we are recognized by the quality of our reports. Honestly, the reports that come out from various centers in India is not much better than a policeman. You say stab injury to chest, policeman says, ha, chhati mein chhura mara. There's no difference between that and what is written. If you're that extensive, that descriptive, your description of pathology inside is very good in disease conditions. In a traumatic condition, your description of the disease contributing is very, very good, then it's nice. So what I'm trying to say is, if you are very good in your descriptive pathology, and you start, like we have been doing, if you start participating in University of Malaya, you know that what Murthy showed, that a little amphitheater, that is the Padua pattern of, the lecture theater, 18th century Padua had this system. That we used to actually take solid organs of a particular case and have a clinico-pathological discussion on Saturday, present the whole case. And we would have clinicians also coming down if it was one of their cases. So if you are able to contribute in this way, and a report is exhaustive enough, you get invited into their mortality meetings, they realize your report has certain value, then you start having some weightage in the clinical system. The way we are going, serving Ministry of Justice and Administration of Justice, we to MOH and its tentacles, we don't seem to contribute much. That's our thought.
Thank you,
Very
sir.
Very aptly said by Harish sir regarding this sharing of fund. When it comes for sharing of fund, very minimal or negligible amount will be shared to the Department of Forensic Medicine. But when it comes for sharing of responsibility, all the forensic people will be seen in their eyes to give all the responsibilities and nasty works of the institute. And we happily shoulder all those things, neglecting our department. It's a naked truth. Almost all those who are in the panel and those who are in the total this one, they know it. And this way we have neglected, but hopefully things will be good. Thank you, sir, again.
Thank you. Thank you, sir. So I know we have crossed our time, but then there is this one interesting question now where Dr. Nilesh has asked that, like, how about going about starting various different units of forensic medicine, forensic toxicology, forensic histopathology with the knowledge and resources that we have, rather than waiting for the DM in various forensic medicine subjects. What's your opinion? That's his question, sir.
My take in this is that first you have to be thorough in your subject, and other people, other departments have to agree that you really exist in the college. Once that happens, then you can request them to include you. Like we now started having other departments asking us कि they want us to be their co-investigators. They want their PG thesis to be done with the Department of Forensic Medicine. So we have somehow brought our department to that level. If we can do that, then we can take their help to the branch out.
Yeah.
Otherwise, we cannot.
Yeah. Pulling in resources till we get in there. Yes, sir.
Yes.
Sir, and one last question, and that's from me. So because you run the one-stop center and everything, like you've talked about DM courses and other courses. So, I mean, like not always forensic experts from different parts of the countries are exposed to enough amount of sexual offences cases and other things. Though the casualty might be there, the cases might not be that heavy or anything. Is there, or do you think there is a need for a small, maybe like a 3 months course or some 6 months training that might be required in some sensitive issues or sensitive areas, like apart from the course that we generally do in our, because during MD forensic medicine, we spend 90% or 99% in many institutions on autopsies only. So what is your say on that, sir? Because
you do require, because when you have to talk to the victims, when you have to talk to the survivors, then there is a different kind of empathy that you have to develop with them. And if I am not wrong, there is one institute which is a NGO, Sehat, which is there in Bombay. It works all over Maharashtra. Sehat has given very good, it has certain courses which you can attend. Most of them are free, but then they have to invite you to attend those courses. Their courses I have found out to be very good. We have attended one course, which was of course only a 3 or 4 day course. But even then, the inputs that they have given, the way you have to talk, the way you have to analyze, the way you have to behave, that is more important than your knowledge. Because as once Professor Vishnu Kumar, my head, he said that forensic medicine is 99.9% common sense and only 0.1% knowledge. And he also said that for common sense is the most uncommon thing in the world. So you should have everything should be there, and only then. But whether any department in forensic medicine or gynecology offer such courses, I do not think so. You have to find out on your own, and if you are interested, you have to go there.
Yes, sir. Thank you, sir. Thank you for that wonderful session. And as many of them pointed out, it was to the point and very crisp and very nice one. Thank you. And thank you to the chairpersons too.
Actually, in the chat box, they have mentioned like we can start these courses on IAFM banner. Mukesh Yadav sir has mentioned, ma'am. Like I am working on this project, something like this. Some short fellowships or something like that.
And I think Dr. O.P. Murthy sir wants to add in a point. Yes, sir.
Yes, if permitted by the chairman, I just put a word key like a super specialty area is a very good concept which is now coming up. So, but in this regard, first of all, we have to standardize our post-graduation training. And after post-graduation training, then we move to the super specialization. And then super specialization of the people definitely will look for the job. Like AIMS Raipur Faculty of Forensic Medicine has taken an innovative step of starting DM in toxicology. So one of my resident who is opting for that in this session after senior residency in forensic, he was asking, sir, what is the job perspective? Mega, you will be having 2 job perspective. One, you can be employed as in forensic medicine as a teacher, no doubt we have completed senior residency. Second, you have a scope in casualty because you have done in a toxicology and have done the most of the services in casualty. So you become a casualty man. So you can be easily accommodated in a part of emergency medicine or emergency services as if that is the second job. So once you become useful, there will be a lot of scope. Only thing, the society recognizes useful people. As I told in the beginning, nobody wants useless material. Because I tell you, the stigma attached with the forensic medicine is too much. Once I was sitting with one medical superintendent friend of mine in institute, and some known to relative came for some treatment. So out of a friendly manner, he showed to the doctor's house. So he asked, sir, what doctor? He is a doctor in mortuary. So somehow the patient was very uncomfortable. And though he did not do, but he wanted to snatch papers from my hand, right? Like the mortuary doctor seeing my paper, it means I'm not having a good time in coming. So that is a stigma attached with the forensic people. So we have to come out of it by our work and value, as I told you. And so that is the way the super specialization is very much needed. But first we have to practice and improve ourselves to create a standard teachers and trainers. Then only it is feasible. But it's an innovative step by AIMS Raipur. And thank you very much for the opportunity.
Tamil Mani sir has raised his hand.
Thank you, sir. Dasari sir have a wonderful presentation regarding the super specialty in our forensic department. So my question is, already this year, 72 MD forensic medicine seats were not filled already vacant, sir. Whether we are creating these type of specialty will attract PGs, or it may be the solution for that forensic specialty to improve the forensic specialty in India.
I didn't get the question.
So the question was, there is right now 72 vacancies which are there even after the counseling. So sir is asking that if we introduce more super specialities and subspecialties, will that attract for people to MBBS students to fill in the seats?
No, it will not. Because even if we improve, come out with super specialties, which in the present scenario, I think is very, very difficult task. Forensic medicine still has to come out of the stigma, like Dr. Murthy has just informed. We have to come out. We have to prove ourselves first. The subject has to come at par with any clinical subject to attract people. Just having super specialties is not going to attract, because finally everybody will ask, what next? That we cannot have answers. The only answer is go and join a government service or go and join some other service. So the problem is super specialties are not going to invite people. No, you have to be a better subject, better teacher, better this one. And people should recognize that forensic medicine is, yes, at par with other clinical subjects. Then you can have. Otherwise, I know of institutes which have 7, 10 seats in forensic medicine and 1 candidate or no candidate.
Yes, sir. That's the better truth nowadays.
Yeah, Tamil Mani, I'll answer your question.
Thank you, sir.
Just a minute. As Tamil Mani said, before going for super speciality, first we'll have to prove our skills. You just detect 2 cases of negligence of a clinician. Then you will have the entire hospital attraction towards you, and whatever funds you ask will be given to you. For example, when we detected 1 case of negligence, immediately a computer assisting was given and all funds were given, including autopsy room was made AC. So we have to prove ourselves by our work and the report, not just, as you said, by just it is a stab and a murder. So you give a detailed report, and when you find out the negligence on the part of the clinicians, even if you do not make it public, you detect it and put it in the mortality meeting, you will have your due importance. Thank you, Tamil Mani.
Thank you, sir. Thank you, sir.
If I may quote Dr. Vishnu Kumar and the way he worked, if we were not getting the right kind of gloves and scalpels in the department, he'd say, I'm sending all the relatives to the MS's office. We would get everything we wanted.
Right.
Thank you, sir. Thank you all. And we put it in this thing, be the energy you want to attract. So that's the thing, what it concludes, I think. We have to be the culture medium, and we have to, once we soar, only we can drive, right? So that's the thing. Thank you, sir, again for the wonderful session.
Ma'am, I just want to ask apology to Dasari Harish sir and to all the delegates, ma'am. We are lunchtime. We have taken a run the 30 minutes of the lunchtime. We are really sorry. We'll not repeat it next time. We'll try to catch up with the time.
No need. This is also what is known as the seeding problems. This is your first conference. Next conference, we know you will do better.
Thank
and
you, sir.
You will do it. Don't worry. This is just seeding problems, nothing else.
No problem. Anyhow, we don't have lunch.
Thank you, sir. I can remember you saying, "Bache, next time." Thank you, sir. Thank you. And I thank the chairpersons also, Dr. Vijay Kumar and Dr. Das, for your valuable contribution. We will take a lunch break now. And since our time has been restricted, we'll have a half-an-hour lunch break and a small exercise to our